Good afternoon, everybody. And my name is Oladapo Adewuya, and I'm a consultant cardiologist and specialist in medicine. And this afternoon, I'm talking about mixed connective tissue disease and heart failure. And the reason for this presentation is to highlight the fact that from ordinary general physical examination, we can actually detect the underlying cause of a disease, and that general physical examination should not be overlooked. In this case about mixed connective tissue disease itself, it's a very rare disease, a rare autoimmune disease that also has inflammatory components. And it's actually the underlying cause of the heart failure and the pulmonary hypertension we found in this patient. And this patient was a 52-year-old female. She was admitted for symptoms and signs of heart failure, like breathlessness, not being able to lie flat or top near, easy fatigability. She just gets tired easily. But she's been having these recurrent fevers and aches and pains for over a year before she presented in heart failure. She also had leg swelling. But when we did a simple general physical examination from head to toe, we found that she seemed to have a relatively small mouth called microstomia. She had the lower eyelid was tethered, that it was attached to the skin there. And we found that again that she had these deformed fingers, which was like swollen also, swelling. They call it interphalangeal joint. The fingers were swollen and deformed, and the legs had the legs were swollen too. So we started thinking that why should a patient have deformed hands and at the same time be in heart failure? So that prompted a search for us to look for the reasons why all these entities are coexisting. So a literature search about this condition led us to the fact that this could be a rare disease we were looking at. So I went over to the medical records to get information about her, because that was the time we were using case notes and everything. We looked for the information, and I got to know that she had been attending the hospital for a long time and complaining of symptoms that were already chronic, like body pains, recurrent malaria, in quotes malaria, not really malaria, just fever and fatigue all the time. But right now we have her presenting with heart failure. So we thought our team of healthcare workers, the consultants then, and other nurses and healthcare workers thought that, what are we looking at? Could this be something that we've not seen before? And we felt there could be connective tissue disease here. So we decided to do more investigations. We did a chest x-ray. We found that she had this huge heart, and she also had evidence of fibrosis on the imaging, chest imaging. We did a computerized tomography of the chest. We found that she had fibrosis. She had honeycombing of the lungs, and thickening of the septa of the lung, thickening of part of the lungs. Imagine somebody in the lungs that is supposed to be soft, just seeing signs of hardening in the lungs. She had all that. And we did an echo on her, echocardiography, and there was high pulmonary pressures like 60.1 as compared to the normal, which is less than 45. And we also found that her ejection fraction was low. Ejection fraction was supposed to be above 50, hers was like less than 40. So we had to send the blood for serological analysis to determine whether she had cardiac, respiratory, and rheumatologic disorders. So we asked for baseline investigations. We asked for the full blood count, total and differential, electrolyte and urea. We asked for urinalysis. We evaluated the kidneys, and we evaluated for markers of connective tissue disease like rheumatoid arthritis and rheumatoid factor. And we also checked for the U1-RMP, that's the ribonucleoprotein, and other markers of inflammation and connective tissue diseases. When the results came back, we were shocked at what we found, that the U1-RMP was eight times the level of normal, which was more or less telling us that this is likely a mixed connective tissue disease. And that led us to the prevalence of the disease. The prevalence of this rare disease is just 1 or 1.2 in 100,000 people. Some practitioners may not see it throughout their career. And since we saw this, we decided to write it up and publish it. And interestingly, when this rare disease was published, within 4 weeks, we had 4,000 people reading about these cases worldwide. And it was happening right here in Nigeria. And so we want to highlight by this webinar that general physical examinations are very important. When we see a patient, we should look at what they have. We should not ignore the fact that the abnormalities we see accidentally in them could be the underlying cause of a major or much more severe disease. In this case, it was the deformities of the hands we saw that pointed us to the fact that this patient could be having a connective tissue disease leading to heart failure. So cardiologists should be very, very aware of the fact that heart failure itself is not only caused by hypertension or caused by stress or maybe hereditary. It could be connective tissue disease. And so we found that the best way to manage this patient was to make sure that she comes out of the heart failure, which we did successfully. But she had deterioration in the rheumatologic findings. She was complaining of severe pain all over her hands and body, and she could not lift her body from the bed. And that leads us to mixed connective tissue disease as a definition. So the mixed connective tissue disease itself, it's an overlap of three diseases. Like you have the systemic lupus erythematosus, you have systemic sclerosis, and also polymyositis. And briefly, the systemic lupus erythematosus is an autoimmune disorder, and they are all autoimmune disorders, but with different mechanisms. And the systemic lupus erythematosus is popularly known as lupus. It affects the whole system. It's a systemic disorder, affects the skin, affects the neurological system, affects the renal system. And patients present with all kinds of symptoms like fever, body aches, and the typical malar rash. That is this rash across the face, and also affectations of the blood vessels. Now, the second component of the disease is the systemic sclerosis. It means hardening of the blood vessels, and this is one of the things that causes one of the likely underlying causes of the pulmonary hypertension in the patient. The patient had this pulmonary hypertension, and we suspected that she had fibrosis of the blood vessels of the heart and the lungs. And the third component of the disease, which is the polymyositis, which has to do with the pain in the extremities, the pain in the muscles. The this patient could not move the legs properly and the shoulders properly. There was weakness and there was pain in all those muscles. And polymyositis affects the muscles closer to the trunk, like the thighs, like I said, and the shoulders. And the patient had all this. So mixed connective tissue disease is a combination of these three diseases, and it's called Sharp's syndrome. So the underlying cause of all this is autoimmune disorders that also affected the heart. And when it affected the heart, it pushed the patient into heart failure with reduced ejection fraction, frank heart failure. And that, as cardiologists, we should be able to suspect diseases that that could actually be a risk factor for our common heart failure, apart from hypertension. So it all starts from having a high index of suspicion and knowing fully well that the patient you're seeing may not just be as innocent looking as you think. It's just that there's an underlying disorder. And in this particular patient, because of the hardening of the blood vessels, the fibrosis of the skin, she looked older than her age. She was in her 50s and she was looking as if she was in her 80s. And from what you call the local belief, she believed that her husband was using her for something spiritual that was negative. And we had to assure her that, yes, we understand how you feel, that you look older than your age, but we feel that there's an underlying disease. So doctors should also be aware of cultural nuances to the belief and the knowledge of disease around here, and not to dissuade it, but to let it serve as a pointer of more severe diseases like heart failure, like connective tissue disease. So in summary, mixed connective tissue disease itself is an underlying cause of heart failure and pulmonary hypertension in patients. Thank you.